3, 2, 1.
We'd like to welcome you to another edition of Grok Talk, brought to you by New Hampshire's leading conservative blog site, GraniteGrok.com. We are your feared extremist, right-wing, hard-charging, gun-toting, opinionated, outspoken, rabble-rousing, letter-writing, radio microphone-stomping conservatives and rational libertarians. So get ready for more news and opinion you could only get from GraniteGrok.com.
Grok Talk.
Welcome back to Grok Talk. Turn this microphone up. It is July 25th.
All day.
August. Getting near the end of summer, ladies and gentlemen. Please take some time to check us out on iHeart, Spreaker, Stitcher, iTunes, and TuneIn. We'd like you to like us on Facebook and follow us on Twitter. We have hundreds and thousands of videos on YouTube. Go to Granite Grok on YouTube. We're also on Ustream, which you may be watching this program on at this very moment. But we're going to move forward. I want to thank Kimberly Morin, who may still be there. I don't know. You still there, Kimberly?
I'm still here.
All right. You hang on. Keith Carlsen in the room. He is here to discuss the Health Care Compact. We did have somebody in to talk about this a year or two ago.
Yes.
And I can't remember. Well, let's talk about it again. Anyway, welcome to the show. First of all, let me turn your microphone up.
Thank you.
Thank you. Let's try that.
Thank you.
Thank you. No, that's not you. Is that you?
Thank you
There
for having
you
me on
are.
the show.
I
There he is.
keep adjusting. There he is. We changed something again. I don't know what it is. They're not in the right order anymore. I got to number them. I got to number the headset, Skip. We got dots, right? Let's
We have
number
dots.
these puppies. So, welcome to the show.
Thank you. I've been a fan of Granite Grok for years, so it's an honor to be on your show.
Okay,
Oh,
we've
thanks.
been a fan of healthcare for years, and we have a brief understanding of the healthcare compact, but it's not a topic that comes up a lot, even though healthcare does. I understand what the mission is, but why don't you just explain it for our listeners, and then we'll go from there.
Sure. So the Healthcare Compact would allow the states to actually take control of healthcare policy. It's an interstate compact, which is an agreement among two or more states. It's part of the Constitution, Article 1, Section 10, Clause 3, the Compact Clause. And so it's an agreement among two or more states. And sometimes the federal government also gets involved when the compact actually tells the government what to do. So in this particular case, it will tell Congress to fund the same money that's funding health care, the Medicaid money, the Medicare money, bring it to the states, but enable the states to look at all of the there's thousands of pages of federal health care law, all these different ordinances, regulations, code. It would allow the states to look at that, figure out what works for the unique population of that state, and if something doesn't work or 500 pages don't work, the state would be enabled to remove those restrictions. So it's a block grant with no strings attached. And then the third thing is because state reps aren't, or state senators sometimes even, aren't experts on every issue, it would create a non-binding advisory commission. And you guys were actually talking about laboratories earlier. So it would allow 50 laboratories of democracy or republicanism to be in action. The 50 different states could all have their own health care issues, figure out what works for them, and this commission would figure out what's working in various states, figure out ways to make it more affordable, more accountable, and improve services. And if something worked let's say something worked in Florida, we could try that in New Hampshire, or if something failed completely in California, we would know not to try
Like
that
gun control,
approach.
right.
Exactly.
All right, yeah, that's a cool idea. Now, you sent me a link to a letter from the Secretary of State of Kansas, correct?
Yes.
Yes. Chris Kobach. Dear Republican Member of Congress, dated July 9th, 2015. And now, is Kobach like one of the leading lights of this whole project, or?
He's the Secretary of State of Kansas.
Mm-hmm.
He thinks that as a Secretary of State, he has to promote the positive legislation that his state passes, and he believes this is the only solution to fixing Obamacare or going around Obamacare while President Obama is still our president.
Mm-hmm.
So he's very determined to encourage people to pass this.
Well, the Founding Fathers plainly did not intend for the federal government to have any authority over health care or health insurance, as James Madison's Federalist 45 makes clear. Nevertheless, The Supreme Court has twice found a way to make it possible, first by distorting the taxing power of Article 1, Section 8, then by implausibly reading exchange established by a state to mean exchange not established by a state. These rulings left many who cherish the sovereign authority of states wondering if there was any way left for the states to avoid the overreaching federal mandates and regulations of Obamacare. Fortunately, there is. We'll put this up. I have
read the last line that's underlined on that, though.
It is important to note that Compact Clause does not require the president's signature. Only Congress need approve.
Very, very well timed, given the particular balance of power between Congress and the president and the political parties.
We need a few more state compacts. I seem to remember, actually this is Kansas, but I noticed that Oklahoma was on the list. Weren't these states parties to the initial lawsuits that basically said you can't establish subsidies in our states and penalize our employers? Only we can do that as states.
Some of the states
basically said if we don't have a state exchange, the IRS, can't come in and intrude on our businesses.
Some of the states were. That's not really directly related to this. But if you turn to the second page, there's 9 states that have already signed this compact. Mm-hmm. And it's been discussed in the majority of states, including New Hampshire. The Josiah Bartlett Center wrote positive things about it in 2012. It passed the New Hampshire House. Unfortunately, typically with a bill, it doesn't usually pass the first time it's proposed. But I assume it will come back in New Hampshire, and it's being discussed in Vermont and Montana and Ohio and states across the nation right now.
I noticed that Senator Kelly Ayotte's not on this list.
Yeah, this just went to
surprise.
This just went to the 94 representatives and senators that live in the 9 states
that have already
passed the healthcare compact.
Okay.
And
well,
the thing about the compacts are, a state doesn't have to pass them initially. So let's say the healthcare compact became federal law 3 years from now. New Hampshire could join then, or join and then withdraw. A state can join and withdraw a compact at any time. So it's not required for, this. New Hampshire hasn't missed the boat, is what I'm trying to say.
Okay, I have a question, and this is really for the other 2 Goxes. And Kimberly, you're on the phone still, right?
I am. I'm listening because I've been wanting to talk to Keith about this, so this is great.
Okay, that last line that Steve wrote about, that it only takes Congress to approve and not the president. How many of us really do believe that Kelly Ayotte would vote for this and permit New Hampshire to participate in one? Here in studio, raise your hand.
Who do I think? Do I think?
So you think Kelly Ayotte would vote for it?
I'm waiting. I'm clarifying the question. You're asking if I think she will or won't.
She will or not.
No.
She won't.
No.
She won't. Kimberly,
My hand's down.
your hands down. And I'm not asking you because you'll get yourself in trouble. See, we get to say things and do things that other people can't. So okay. So much for that. All right. So continue, sir.
Well, right now, actually, Vermont. Vermont has 3 political parties, believe it or not. There's the Progressive Party, the Democratic
Socialist
Party, and then there's a few Republicans there. And there's a tripartisan bill right now that's sponsored in Vermont. Because not only does this, it doesn't really, it's not a direct attack on Obamacare. Some people might look at it as that, but it enables the states to actually look at health care. And so right now, under the current federal health care system, there's a couple commissions that are people that are appointed bureaucrats, and they control healthcare federal policy, which controls it for the entire nation. This would allow the states to control it, so the legislators of the states would be in charge. So in Vermont, every legislator, the governor's elected every 2 years. So actually local officials that people shop at, well, they don't have Market Basket in Vermont, but they have Shaw's and Price Chopper. So people that go to Price Chopper in Burlington, they would see their local state rep or state senator, and they could actually interact with them. And if the great thing about it is you can fire a state senator or a state representative at least. And in D.C., these bureaucrats, we didn't elect them. We don't appoint them. We can't fire them. It's all people in D.C. that can't even pronounce the name of our capital or our rivers or our mountains. So these people have never been in New Hampshire.
Concord, New Hampshire.
But it kind of scares me that Vermont is going for this because they tried single payer.
Yes.
So what is that kind of telling me?
It tells us that they want the freedom to put single payer in place without having to deal with the federal government.
Yeah, but it also means that they may want to leech off of the other states, because when they looked at this, it was going to cost like 3 times the state budget and raise taxes 75% on
With
everybody.
the compact, they'd only get their block grant, and they'd have to make do.
Yeah, and really that's the only this laboratory of democracy decided we'd be taxing ourselves to death and backed off of it. But man, they are so upset that their citizens don't have enough money from which to spend it on the citizens. You know, you can't make this stuff up. Keith.
So the federal healthcare policy was messed up even before Obamacare because it was centralized. But with Obamacare, it created all these taxes, and some of them haven't even hit us. There's the, Cadillac tax that some people are talking about. The mayor of Manchester says they're going to have to increase property taxes by $6 million a year, just in Manchester. And so this is going to hit the entire nation. But, again, you can actually opt out of any and all federal health care regulations.
Calm down, Skip.
Oh, this is what drives me crazy.
So
why is it that government always has to get more because it's going to cost government more? Why don't they just take the razor to their own neck and say, enough, we can't do this. Sorry, employees, you can't have this Cadillac health plan or anything else that keeps costing so much money. Why aren't we when I was in government, my motto was the rate of government spending should never rise above that of the rate of income rise of ordinary citizens. Where are these numbskulls Republicans, because that's what Gatzis is, and he wants to be still mayor? Why don't they think of this thing? This would be an obvious winner.
Because they're afraid of the union. The biggest contracts and expenses in every municipality in this state and every state across the country are union contracts.
Let them strike.
And union pensions. And that gets me back to my 100% of nothing that I was going on about in the pre-show, which is, the unions are going to stick out to keep their pensions, keep their benefits under all kinds of threat and duress, and they'll swing the elections, except at some point the town, the state, the county is going to go bankrupt, and they'll have 100% of their guaranteed pension, but there'll be no money in the pot to pay it, and they're going to get 100% of nothing. They don't understand they're better off getting, say, 90% and actually keeping it, or getting a 401k plan and actually keeping it. They want the taxpayers to be on the hook until the taxpayers themselves go bankrupt.
I mean, Keith.
I want to ask Keith a question.
Go ahead.
Keith, if states are going to be controlling this, are they getting federal money, or, which is basically their own money, or are they doing this just internally in the state and figuring it out?
The federal money they're currently given, with tens of thousands of pages of strings attached, they would be given without any of the strings. And also, it wouldn't be exactly the exact amount of money. It's based on 2010 figures, and then it's inflation is figured in, and then population. So it would be slightly less probably than they're getting now, because for example, the medical devices tax wouldn't be happening, and all these taxes wouldn't be happening that Obamacare creates. But the states would actually be able to look at the money, put it where it's needed, not where some bureaucrat that's never been to Iowa or Idaho thinks they should put their money, or, of course, New Hampshire. Okay,
Keith, I got a question for you. Stockton, California. Multiple towns and cities in California have gone bankrupt, and it leads on to what Mike was alluding to, in that these pension costs for the salaries, which sometimes are in excess of their actual salaries, the health care costs and everything else, the property taxes are going way more towards the unionistas than it is for providing services like we saw in Detroit, and everything else was going bad. How could you do this and not have it seen as being a bailout for those types of towns that have willfully misspent all of their money following the blue social model for decades?
It would give the state of California, the people in charge of it, the people in charge of the state of New Hampshire, which, by the way, you could be one of if you ran for state rep. Anyway,
I wish I could. Trust
it would give
me.
those people the flexibility, the innovation, the accountability to actually make changes. And I don't really see the direct correlation of how it's a bailout. Like, if New Hampshire gets this, I don't see how New Hampshire would necessarily use it to help the unions. They would use it to help the people of New Hampshire, and the House and the Senate would have the debate, and they would spend the money towards the people the way they wanted, and if they did do it the wrong way, they would be kicked out of office, which is something that this actually brings back to the healthcare debate, because right now we can say, well, our congressman this, our congressman that, but our congressmen have no authority to change healthcare policy under the current system.
But I'm looking at the state of California, which is just about as bankrupt as you can be other than Illinois, and you look at these towns, and they run themselves into the ground. Now all of a sudden they get this massive amount of money coming in from the federals.
It's the same
well,
money.
it's the states, but the states are going to they're going to bail out the towns because...
Well, maybe they aren't.
But, yeah,
Probably.
It's the same money with no strings. That's
Yeah,
really.
yeah,
There's no new bailout. It's the same bailout they've
but
been
it's still
getting.
a pot of money
It
coming
doesn't
in.
change that problem, though. It's the same problem. The towns are
Well, that's-
still going to go
that's what-
bankrupt, and it's state policy that will have to affect how that money is distributed. And if they decide you're a bunch of incompetent bastards, we're not giving you a dime, they can decide that at the state level, not at the federal level. And that's where we're going to go on a break, and we'll be right back. So everybody stay tuned.
Raw Talk.